Hello and welcome to Kneevolution once more. It's Paul Hobra here. Just going to explain very quickly what Arthrosamid is, because you may not have heard of it. You may be searching around for videos about what Arthrosamid is. You may have knee osteoarthritis and you're desperate for a solution that isn't having surgery. This may well be the answer. In studies, people under 70 who have knee osteoarthritis have an 80% success rate by having Arthrosamid. It's a non-degrading hydrogel. That means it's in your knee forever. We inject it, there's 6 syringes that go into your knee, and we fill the knee cavity with this really robust gel, which can give you a little bit of support there. But its primary function is to line that angry capsule, that angry synovial capsule. It integrates with that. It stops more inflammation coming in and calms down the inflammation that's inside the joint. This is where a lot of the pain comes from. We also have seen signs where bone marrow edema, this white shadowing you see in the actual bone joints of the knee on MRI scan, is reducing down to nothing. So by getting rid of the bone marrow edema, by getting rid of the inflammation and holding it at bay, which is the most impressive part of what this gel does, alongside this slight cushioning effect, we are finding this 80% reduction in pain and improvement in mobility for our patients that are under 70. And it's only slightly worse actually if you're over 70. It really is a great option if you want to avoid surgery. You can come to a clinic just like this and have Arthrosamid, and it's available quite widespread now, still fairly new, but you will find places where you can get it done. If you go to kneevolution.co.uk, you'll find our clinic. We're in the northeast of the UK, and we're doing that in a slightly different way. How's that? Well, we're combining regenerative medicine, such as shockwave therapy and an electromagnetic transducer over the knee, which are further reducing inflammation, but also helping to slightly wind the clock back because it is a regenerative treatment. So we're treating the bone cell tissue as well. So think about this. We treat the bone cells either side of the joint. We're also reducing pain and inflammation, as well as the Arthrosamid being in situ, reducing pain and inflammation. What the Arthrosamid isn't doing a great deal of is rejuvenating that bone tissue. So by combining shockwave and electromagnetic transduction therapy together, has anecdotally shown great results in my patients here at Kneevolution in Hexham in the northeast of England. And what's really notable is when someone does a twist or a turn, because frankly you still have arthritis in your knee, and your knee would have a massive flare without these treatments, just gets a little bit painful for a few days. We can top up the dose with some shockwave and EMTT, and it seems to be springboarding that treatment along again and giving people a great deal of relief. So that's why we're unique. Hopefully you understand a little bit more about what Arthrosamid is doing. Consider it, get in touch today, ask all the questions you want to. I myself will come on the phone and have a talk to you if you want and explain exactly what it could do for you. But it's that initial assessment in person where we really get down into the nuts and bolts of what is going to work best for you. Do a little ultrasound scan on your knee, we do a functional test, we do some functional scoring, and after that we can tell you what treatments we think are best. And I really do hope for your sake that Arthrosamid and shockwave and EMTT turn out to be the answer for you, because for many of our patients it has been completely game-changing and life-changing.